Hello, my name is Ahmed Mahdi, and I will be presenting my scholarly project Semaglutide Evaluation of Weight Loss Algorithm into Practice. This project was completed with the assistance of Dr. Jeffner Hopner, DNP Chair, Dr. Snell, and community member Dr. Gideon Kwok. The purpose of this project was to compare the long-term weight loss effectiveness of semaglutide and phentermine in non-diabetic obese patients, employing translational science-based practice guidelines. The aim was to evaluate and compare semaglutide in the clinic as a safe alternative to phentermine while comparing the weight loss and BMI of both drugs. This scholarly project allowed patients to understand the benefits of generic semaglutide compared to other medications as well as made semaglutide more accessible and affordable to obese patients who otherwise could not afford the medication through insurance due to the cost. Through clinical policy, developing formularies with compounding pharmacies, and lifestyle changes with diet and exercise, clinics were able to positively improve weight loss with translational science of semaglutide into practice. An obesity diagnosis negatively affects a patient's quality of life, resulting in an increased workload for the cardiovascular, respiratory, and digestive systems. Weight loss was directly correlated with reductions in hypertension, diabetes, hyperlipidemia, arthritis, sleep apnea, and fatigue. Losing weight improved fatigue and increased energy and focus. Semaglutide was offered weekly and administered subcutaneously by the advanced practice nurse. Semaglutide helps the body detox the liver, increase absorption of nourishment, and lose 15% of total body weight. Helping obese patients return to a healthy weight was the goal of the clinic and the patient. The semaglutide protocol provided the patients with a cost-effective treatment for weight loss. The prevalence of obesity was rapidly surged, with almost 1 in 7 people on Earth now considered to have obesity. Common obesity complications are high blood pressure, diabetes, dyslipidemia, hypertension, sleep apnea, arthritis, cardiovascular disease, gallbladder disease, and gout. Persistent challenges to successful long-term weight loss include overeating, unhealthy lifestyle habits, and lack of exercise. Semaglutide, a form of pharmacological therapy, serves as an adjacent for weight loss in non-diabetic obese patients. As a glucagon-like peptide 1, it enhances insulin production, lowers blood sugar levels, reduces appetite, and delays gastric emptying. Weekly subcutaneous semaglutide injections result in a notable initial weight loss of 15 and 20% after 63 weeks. This treatment decreases appetite, improves eating control, reduces food cravings, and is associated with clinically meaningful weight loss. Semaglutide, a GLP-1, produced in the gut. This increases the production of insulin, inhibits glucagon secretion in the liver, as well as reduces appetite and energy intake while delaying gastric emptying. Glucagon-like peptide 1 is an eccentric hormone that slows gastric emptying, allowing increased absorption of nourishment into the stomach and promotes satiety, which reduces food intake. Weekly subcutaneous injections of semaglutide result in initial weight loss of 15 and 25% and total body weight after 63 weeks. The brain produces various hormones, including GLP-1, regulating processes such as food intake, satiety, fluid balance, thermogenesis, lipid metabolism, and gastrointestinal motility. Semaglutide's impact extends to renal function, influencing urine production, water intake, and electrolyte excretion. Semaglutide, through GLP-1 receptor activation, suppresses food intake via pKa-MAPK induction inhibition of AMPK. AMPK, a nutrient-responsive kinase, influences food intake, with its activation stimulating it and inhibition decreasing it. In her exploration of nursing models and theory, Pender observed a predominant focus on negative motivations. Consequently, she formulated the health promotion model theory, unequivocally centered on positive motivations aimed at fostering wellness, prevention, and health lifestyles. This theory provides nurses with a comprehensive understanding of the key factors influencing health behaviors, empowering them to engage in behavioral counseling that promotes healthy living. By scrutinizing prior behaviors, assessing the likelihood of patients adopting healthy practices, and considering variables impacting health behavior, nurses can effectively tailor interventions. This DMP project's conceptual framework centers on health promotion, aligning with Pinder's health promotion model. Pinder designed this model to shift the focus from illness absence to actively promoting health, explaining and predicting the health promotion aspects of lifestyle. Educating patients on maintaining a healthy lifestyle is crucial for longevity, and Pinder's model offers a prevention approach that can save substantial healthcare costs if healthcare professionals advocate for healthy lifestyles actively. The project integrates theory and research with nursing practice, emphasizing understanding individual patient characteristics, including health status, past weight loss experiences, and underlying conditions affecting their ability to adopt health promoting behaviors. Tailored interventions, considering specific conditions like semaglutide and phentermine, use the patient's emotional responses, influence adherence, and overall experiences with the weight loss program. Project goals focus on enhancing patient self-efficacy, achieving weight loss, and promoting health behaviors like improved nourishment and increased physical activity in obese patients. The model emphasizes positive motivations for health improvement, aligning with the idea that weight loss, even without existing illness, promotes health and enhances quality of life. It resonates with the patient-centered approach of the DMP project, encouraging patients to pursue weight loss based on their preference and needs. In a Doctor of Nursing Practice project, SPSS was employed to analyze data comparing means and inferential statistics at a West Coast aesthetic clinic. The sample included electronic medical records of obese patients evaluating semaglutide and phentermine groups over 8 weeks. The groups with the same size and treatment duration underwent an independent sample t-test. Semaglutide received lifestyle education, while phentermine had no prior instruction. Data collection occurred from February 1st to April 1st, 2023, using paired t-test on interval changes, BMI, pounds lost, and abdominal inches. Frequency measures tracked counts, and data were collected weekly during semaglutide injections. The design was quantitative and exploratory, utilizing a retrospective chart review with 150 EMRs, 75 pre and 75 post implementations for both groups. Participants were not engaged, and all identifiers were removed for confidentiality. The comparison timeframe for each patient was 8 weeks. The independent sample t-test compared means between semaglutide and phentermine groups. The exclusion criteria: the sample size for the weekly semaglutide and phentermine injections were 75 patients with BMI 30 or greater, and it excluded any patients that had a past history of any kidney damage, pancreatitis, or thyroid cancer. It excluded patients that under the age of 25 and over the age of 65. Patients were not allowed to be pregnant or lactating or have severe heartburn and had to have a diagnosis of obesity in their EMR. Also, this study excludes insulin-resistant patients as well. Patients with their weight, abdominal circumference, and vital signs measured at each visit. The expected outcome for the patient was to have a sustainable lifestyle change and lose 15% or more total body weight with semaglutide. The weight loss results were to decrease the visceral fat percentage and maintain or improve muscle mass and bone density. The treatment protocol for semaglutide for each patient was 8 weeks. A substantial inclusion-exclusion process continued until the anticipated 150 EMRs were reviewed, A power analysis was calculated using SPSS program utilizing a delta of -4 as a significance criterion. And here's a sample of demographics: age 25 to 60. Gender and ethnicity were not relative to the study. Patients had to have a BMI of greater than 30. Data collection spanned from February 1st, 2023 to April 1st, 2023, utilizing a pair-T test to analyze changes in BMI, total body fat percentage, and abdominal circumference with an 8-week period for each independent group. The paired sample T test, a parametric procedure, operated under assumptions such as numeric continuous data based on a normal distribution in an absence of outliers. Frequency measures assess data count collected every 7 days during clinic visits of both phentermine and semaglutide patients. Interval data with equal distances between values measured variables continuously. Central tendencies gauged mean BMI, total body fat percentage, and abdominal circumference between semaglutide and phentermine groups. SPSS was employed for analysis utilizing an independent samples t-test. The quantitative exploratory design utilized SPSS for a comparison of means in inferential statistics. De-identified data transcribed onto a collection sheet and imported to an Excel document facilitated analysis. An independent sample t-test compared semaglutide and phentermine groups, both comprising the same number of patients over 8 weeks, assessing the effectiveness of weight loss intervention. The subsequent step involved the upload of collected data to IBM SPSS statistics for analysis occurring between April 1st, 2023 and April 15, 2023. This period saw the commencement of descriptive and inferential statistics analysis on April 15, 2023. In summary, the project's well-coordinated timeline encapsulated key milestones from its approval phase to the conclusion of data collection and statistical analysis. Each step was executed with precision, emphasizing adherence to ethical guidelines and a commitment to thoroughness. The Mann-Whitney U-test was used for normally distributed variables, aligns with the nature of data and objectives of the project. It was employed to analyze changes in BMI, adipose tissue, and abdominal circumference between the phentermine and semaglutide groups. In all three tests, the p-values were less than 0.001, demonstrating a significant difference between the two groups in terms of BMI, adipose tissue, and abdominal circumference. Various statistical tests were discussed in the paper, including the Mann-Whitney U-test and the independent sample t-test. As a last point, presenting information in an effective manner is an important aspect of disseminating project findings and discoveries. The choice of statistical tests, such as the independent sample t-test for normally distributed variables and the Mann-Whitney U-test for non-normally distributed variables, aligns with the nature of the data and objectives of the project. Normality tests, specifically the Kolmogorov-Smirnov and the Shapiro-Wilk test, were employed to assess the distribution of data, with alternative non-parametric tests chosen if normality assumptions were violated. The presentation of results utilized standard reporting methods in the text, complemented by the use of graphs and charts such as histogram charts to visually represent data distribution. An evaluation of the process involved the frequency and content of patient visits, adherence to the weekly injection schedule, and the extent to which patients engaged with the educational materials provided. The primary outcome measure was a change in BMI, total body fat percentage, and abdominal circumference for patients of both semaglutide and phentermine groups. An independent sample t-test was used as a primary statistical test to compare health metrics between phentermine and semaglutide groups. The approach, however, was based on several key factors, one of which was the variables under examination were normally distributed. Kolmogorov, Smirnov, and Shapiro-Wilk tests were used to determine the normality of each data set. Phentermine and semaglutide groups were found to violate normality for three specific variables: BMI, adipose, and abdominal circumference. As a result, three variables had p-values less than 0.05, which indicated that they did not follow a normal distribution. Considering these violations of normality, it was deemed inappropriate to use independent sample t-tests for these variables. Rather than using the parametric Mann-Whitney U-test, the author used the non-parametric Mann-Whitney U-test. Phentermine with a p equals 0.30 and semaglutide with a p equals 0.182 groups showed normal distribution characteristics for systolic blood pressure, allowing independent sample t-test to be continued. Then the Mann-Whitney U-test was used to analyze changes in BMI, adipose tissue, and abdominal circumference between the two groups. In all three tests, the p-values were less than 0.001. These findings demonstrated a significant difference between the phentermine and semaglutide groups in terms of BMI, adipose tissue, and abdominal circumference. The findings from this project will be discussed in the next end of this presentation, including limitations and pros, implications, insights, interpretations, and implications. The presentation of results utilized standard reporting method in the text, complemented by the use of graphs and charts as a histogram chart to visually represent data distribution. The sample data reveals specific mean variables for different variables. Phentermine exhibited a mean of negative 1.42 for frequency, and semaglutide had a mean of negative 3 for the same variable. This is a histogram process of phentermine versus semaglutide for delta BMI. For delta adipose frequency, phentermine recorded a mean of negative 1.66, while semaglutide exhibited a mean of negative 3.72. The delta abdominal circumference frequency showed a mean of negative 1.98 for phentermine and negative 4.28 for semaglutide. And delta systolic blood pressure shows the frequency of phentermine demonstrated a mean of negative 15.75 and semaglutide had a mean of negative 14.04. The critical examination of limitations within the scope of this project is crucial for a nuanced interpretation of its results. This study, comparing the effectiveness of semaglutide and phentermine interventions in obese patients, scrutinizes potential biases and shortcomings across design, measurement, analysis, generalizability, and sustainability. One noted concern is the risk of selection bias arising from retrospective chart reviews, which may lead to overlooking individuals with incomplete or inaccurately recorded information, compromising the respectiveness of the project population. Additionally, variations in data collection methods, including the use of the in-body scale and EMR, pose a challenge to results reliability due to potential inconsistencies in precision. External validity is limited by the specificity of interventions and unique characteristics of the project population, urging caution when applying findings to diverse patient groups. The project's short 8-week duration raises questions about the sustainability of weight loss outcomes, adding a layer of complexity to the overall implications of the intervention. Despite these limitations, efforts were made to enhance internal validity through rigorous statistical methods and standardized data collection processes. Recommendations for future research include longitudinal designs, diversification of the project population, and the standardization of measurement tools to address to address identified limitations comprehensively. These limitations should be acknowledged for a more cautious interpretation of the project results and to guide future research directions in the evolving landscape of obesity interventions. These findings underscore the potential for semaglutide to bring about substantial and sustained weight loss in individuals struggling with obesity. Semaglutide offers healthy weight loss by decreasing adipose tissue and maintaining muscle mass and bone density as compared to phentermine. Interpreting these results emphasizes the broader significance that extends beyond our study's specific focus. But the project not only enhances the empirical understanding of targeted interventions, but also mirrors established trends in the healthcare literature. The effectiveness of semaglutide, as evidence in our project, aligns harmoniously with the mounting body of proof supporting personalized interventions for enhanced health outcomes. Additionally, these findings present evidence-based recommendations that not only resonate with the evolving narrative in healthcare literature, but also emphasizes the imperative for personalized strategies in optimizing patient outcome. In our phentermine and semaglutide comparison, statistical analysis, including the Mann-Whitney test, revealed semaglutide's superior effectiveness in influencing health metrics. These specific findings align with existing literature supporting tailored interventions for improved health outcome. In conclusion, our project's insights on appointment reminders and semaglutide effectiveness offer evidence-based recommendations echoing broader trends in healthcare literature. The study's implications reach healthcare practitioners, policymakers, and future research, recommending the integration of semaglutide into clinical practice and treatment protocols due to its recognized superiority. Future research should focus on long-term effects and applicability of semaglutide interventions, contributing to ongoing efforts to optimize patient outcomes in obesity management. Overall, this comprehensive study positions semaglutide as a promising superior intervention with broad implications for advancing obesity treatment practices and methodologies. The methodological adaptations observed in this project offer viable insights for future research. The utilization of Mann-Whitney test after identifying normal distribution characteristics underscores the importance of flexibility, specifically in studies involving health metrics with potential deviations from normality. To enhance external validity, future research should embrace adaptive approaches and consider longitudinal designs for a comprehensive assessment of sustained weight loss outcomes over time. Diversification of project population in terms of demographics and comorbidities is recommended for a more nuanced understanding. In terms of healthcare policy, the project emphasizes the need for context-specific interventions due to the specificity of the studied groups. While the findings significantly contribute to obese management, caution is advised in generalizing them to a broader demographic. Policymakers should consider the short-term focus of the project, prompting a closer look at interventions, long-term effectiveness, and sustained weight loss outcome. Quality and safety considerations arise from identified limitations and efforts to enhance internal validity. Rigorous statistical methods and standardized data collection procedures contribute to methodological rigor, minimizing potential biases. Ethical considerations, including normal ethics review, enhance the reliability of reported results and mitigation ethical concerns. These considerations underscore the importance of maintaining methodology rigor in research and endeavors to ensure credible and reliable results. In practice, the project's implications evolve using evidence-based guidelines. Prioritize the patient. Further research should focus on improving interventions and assessing long-term sustainability. The influence of healthcare practice is significant, prompting healthcare practitioners to review semaglutide as a viable option in obese management. Researchers should leverage the findings of this project to formulate guidelines urging policymakers to incorporate semaglutide into established obesity treatment protocols to ensure and secure the effective integration of semaglutide across diverse health settings. It is imperative to adopt standardized approaches, comprehensive training programs, and effective communication strategies. This project seeks to provide valuable insights to the field, paving the way for the enhancement of practice in obesity management. Go ahead if anybody has any questions, and here are my references. Thank you for listening. This is Ahmed Mahdi. Thank you.